Hi Leon, welcome to Nashville, welcome to Vive, and welcome to Healthtech with Purpose. How are you today?
I'm doing great. Rishi, thanks for doing this. I really appreciate it. I'm really excited to be at this conference. There's so many great ideas, so many great products out there. Looking forward to having this conversation.
Awesome. And how did you like Nashville?
Oh, it's the best. I actually used to live here,
Oh,
and we were. I love where I live. I'm in North Carolina right now, but Nashville is amazing.
awesome, awesome. So Leon, before we move, to your product and your company, would like to know a little bit more about you, and then take it ahead from there.
Perfect. So I'm an emergency physician. My background is in administrating emergency departments and hospitals. I was um, the head of innovation for an emergency department, then assistant medical director, and then medical director for two large emergency departments. Um, I noticed a gap in the market and went after the entrepreneurial dream. Took a real left turn from emergency medicine administration, but I still do one shift a week in the emergency department.
Okay, that's good to know. Awesome. So how did the idea came in, and can you tell us a little bit more about Ivy Clinicians?
Yeah, great. So the idea basically came from problems that I faced, but also solutions that my wife was seeing. So
Okay.
what I mean by that is on my side as a physician, every time I change jobs and every time the people around me change jobs, there's this like obvious missing piece of information that it was just really difficult to figure out which medical practice staffed which emergency department. So just getting to the first step of like, I am moving to Nashville. What are my options of jobs in this area? It was hard enough to get to the first step. And then you want to know, okay, what are the differences between them? Which ones are good places to work? How much do they pay? What is their relationship between the doctors, PAs, and nurse practitioners, and the nursing staff? There's lots of stuff that go into whether it's a good job or not a great job, and getting just the basic information was very difficult. Then I became a medical director, and I realized there's a whole other side of the problem for the hirers of emergency physicians, especially in rural emergency medicine. Most physicians in the United States live in cities
Yeah.
or in suburbs near the city. So there's a really a crisis of not having enough highly trained
Yeah.
healthcare professionals in rural America. So when I was a medical director here in Clarksville, Tennessee, Clarksville is really not that rural. We were 45 minutes away from Nashville, but because it's one county away, we only had 3 ER doctors in Montgomery County, in our county. Nashville has like a million doctors. It's just not it's trip over doctors walking around here. What we needed was some way of knowing who, if we gave them the right offer, paid them enough, treated them well, did all the right things, who would be interested in working with us. There's no place for them to put themselves on the market in a way that actually works out well. So there's a two-sided problem. What I mentioned about seeing opportunities that my wife was experiencing is that my wife is an ER nurse, and there is really a renaissance of health tech platforms to help nurses find better jobs right now. So whether it's Incredible Health, Nomad, ShiftMed, CareRev, Vivian, you can go down the line. There's over $1 billion currently invested, not total valuation, like current VC money
Wow.
invested in nursing staffing tech
That's
today,
huge.
and almost none for physicians, PAs, and nurse practitioners for the top of the market. So it's time to build it.
Wow, interesting, interesting. So, I was talking to a few people here, and one of the challenges that they see as we go ahead, it was very interesting aspect. The challenge was not tech, but to your point, lack of capable people,
Mm.
in the whole health care space. So I think that's one of the things that you are on the other side of the table trying to address.
Right. Though it's interesting for on the physician side,
Hmm.
there's this idea that we have a shortage, and maybe in the future, when there are more retirees in medicine, but also in the general community. Right now, it's really an imbalance
Hmm.
where in a city like Nashville, there are plenty of doctors, there are plenty of doctors, PAs, nurse practitioners, plenty of everything,
Yeah.
but you draw a circle 45 miles in any direction, and all of a sudden you have lots of humans, lots of people who need healthcare, and it's just very hard for them to get the healthcare that they need.
Got it. Awesome. So, while pursuing this journey, what were some of the challenges that faced?
Yeah, I think the hardest part is everything. So actually,
Yeah.
the one part that hasn't been that hard actually, and I'm totally going to jinx myself, is fundraising, because
Ah,
the problem is like hitting you in the face, right? Like if you go to any rural facility in this country, like there's this need for high quality providers. Any doctor in any emergency physician, or really any doctor, gets that. And so raising money from clinicians has been okay. What's really hard is nobody's done this, right? So nobody's created a platform like ours, which is a multi-sided platform for a specialty where we map out the entire landscape of that specialty, kind of like Zillow did for houses.
yeah.
Nobody's done what we're trying to do, and so that means we have to, come up with hypotheses, try it out,
Yep.
and some of what we try out works, and most of it doesn't.
Yeah.
But there's only one way to find out, which is to build it, get customer discovery, launch what you have based on that discovery, and learn. And so
Yeah.
the hard part is learning fast.
Yeah, yeah. So, once you have solved this problem, would you add different job roles to the whole system? Is that the idea, or like what's the next big thing within this space?
Yeah, that's a great question. So most multi-sided platforms scale by geography, right?
Yeah.
So Airbnb started in New York, and OpenTable was limited to San Francisco, and Incredible Health, which does nursing, they started in San Francisco, and so usually you want a tight geography so you can match your supply and demand within that geography, win one place, and then go from there,
Yeah.
right? The Because we are dealing with a mobile workforce, can't really do that, right?
Yeah.
So one of my friends who's at this conference, an ER doctor, and he has used our platform to apply for places in Hawaii, Utah, and California, and that's just how ER doctors are, right?
Yeah.
So we're going specialty by specialty, starting with emergency medicine, then hospital medicine, critical care, and then there are 32 specialties
Nice.
in the house of medicine, and so we do aim to get to all 32.
Nice, nice. Awesome. So, doing this, what are some of, the impacting areas that you feel, and have you already started making some impact in this space? Your thoughts on that?
Yeah, so great question. So there's we're a two-sided platform, so there's a two-sided answer. I think the side that I see the most directly is the response of the clinicians. So one of the things that happened during COVID, but it was already kind of heading in that direction, is a lot of frustration. If you talk to doctors, there's a lot of frustration out there that because of the electronic medical records being hard to use, and practice ownership is more rare now, and so you're an employee of some corporation that doesn't necessarily isn't aligned with your values, and there's a lot of, and I guess I missed the big one, which is there are just not enough nurses. There are not enough nurses, and we can't do anything without nurses, right? They're the key to everything we do in the hospital. And so one piece of that puzzle is that if somebody feels like their job isn't living up to their expectations, it should be easy for them, especially somebody that's this highly trained, right? So excelled in college and then in medical school and then did a residency, often a fellowship. Like these are like top-notch
Yeah.
people. They should not feel trapped in their job. If the job's not working, it should be fairly easy to find something else that will work for them and for their patients. And so seeing providers who felt trapped
Mm-hmm.
go from feeling trapped to being kind of owning the next step in their career trajectory really is heartwarming for me.
Excellent. Awesome. Awesome. So, just want to understand on both the sides, as you said, it's a two-sided problem.
Mhm.
So, say somebody wants to find a job, what's the step? How do they come into the app, or the portal, and what do they do? And then on the other side of the thing, how does a provider use the whole system?
Yeah, so I'll kind of go through the current and then
Yeah.
what we're doing. So basically, because of the way jobs boards are set up right now, most most physicians get their jobs through word of mouth.
Mm-hmm.
And so the reason that jobs boards don't work for physicians is that our timeline is really long. So to get credentialed in a hospital, it usually takes 3 to 4 months. If you change states and need a new license in that state, that's an additional 4 to 6 months, and the hospital doesn't start your credentialing until you have finished the license, and so it often takes a year to to even get the paperwork to the
Yeah.
point where you can start your job, right? So and everybody knows that, and so the timeline for searching for jobs is way in advance. Residents usually start interviewing for jobs 18 months before they finish residency. Well, what are jobs boards doing? Well, they're posting open job today. Well, open
Yeah.
job today isn't like if you're looking for jobs in 18 months,
Yeah.
that's not the right thing, right?
Yep.
And so what we have built is we've mapped the entire landscape of emergency medicine. So
Okay.
what I mean by that is there are 5,600 ERs in the country. We've connected every ER, and we're the only entity that has this data. We've connected every emergency department with its medical practice, so the employer of physicians, PAs, and nurse practitioners, and it's usually not the hospital. So if you go to the big building, downtown, it's usually not the name on the building that is employing
Yeah.
those physicians, and they don't want you to necessarily know that, and so finding them on Google is really hard.
Yeah.
And that's where the problem started that we talked about a few minutes ago. So once we had that, then we wanted to connect it to other data that clinicians would want when they're looking for jobs. So things like how many patients does that ER see? Are there residents in that emergency department? What are the Medicare star ratings? So is this a good hospital or not? That
Yep.
kind of thing. And so we have a ton of data that we connected to, and then we make it searchable like Zillow. So you search by geography, filter by your preferences instead of bedrooms and bathrooms. It's number of patients and whether they're residents, all the stuff that we talked about. And then on platform, we have the contact information for the in-house recruiter, and so you directly apply through our platform to the in-house recruiter. There's no middleman.
Nice.
No nothing. It's a direct connection. On the employer side, because the clinicians go first, so the physicians, peer or nurse practitioners go first, the in-house recruiter gets that email. We automatically attach the credentialing information and the CV to that email. And so they have a full application in front of them,
Yep.
and they can either reply or not, and it's up to them. It is totally legit application like any other application. And we have seen really great responses from the recruiters because they're not used to this being so easy.
Yeah.
It's not supposed to be that easy to get inbound leads from highly trained physicians.
Awesome. So during the whole process, then are you also gonna track the life cycles, probably reviews, etc.? Because maybe somebody who's already used it probably might use it again to switch the jobs. So what's happening in there?
Right. So that's a huge piece of the puzzle. Is like I had mentioned earlier that it's hard to know which places are good workplaces,
Yeah,
right?
yeah.
That is a challenge. The whole review process is challenging. There is a review site for
Okay.
emergency medicine, but it turned into like a poop on the employer site. And it's like that's not what we do. Like there are customers, that's not how it. So we have to be very careful. So we are starting with objective stuff. So we are doing a salary survey to make sure that folks know how much you would get paid at this place. And then we'll probably do stars, and then we'll have we just want to make sure that it's just not just an insult platform.
Yep, yep, yep. Awesome. So, finally, since we are in Healthtech with purpose,
Yeah.
so what's the main purpose and what's the goal that you want to achieve? Where do you want to go, in coming years?
Yeah, so the main purpose is having patients, especially patients in rural hospitals and in underserved hospitals. So there's a hospital here in Nashville called Nashville General, and they are chronically underfunded. It's hard for them to hire good staff because of the underfunding. Those patients they have every right to receive just as high quality of care as the patient at Vanderbilt or any other fancy hospital down the road. I strongly believe that. And so if we build a better marketplace for physician, PA, and nurse practitioner labor, we can better match the right physician, the right PA, the right nurse practitioner with the right patient so that patient can receive the right care.
Nice, nice, awesome. So, I hope you enjoyed the podcast. Saying hi to everybody who's watching there, and yeah, looking forward to see you grow. And I hope something they have learned, or all those who will be watching, they have learned, and I hope it helps.
Rishi, thank you so much, and we are at ivyclinicians.io.
Awesome.